Hello friends, welcome to the channel Dewdear Academy. In this video, I am discussing the question paper MSc Nursing Entrance Examination Part 7. So the first question is the test to determine the average plasma glucose concentration of a client for past 2 to 3 months is. The test to determine the average plasma glucose concentration of a client for past 2 to 3 months. Options are fasting blood sugar test, postprandial blood sugar test, glycosylated hemoglobin test, gamma glutamyl transferase test. So in this question, the plasma glucose concentration for past 2 to 3 months, it is glycosylated hemoglobin. Option C is the answer, glycosylated hemoglobin, HbA1c. Then the next question. A staff nurse is explaining mammography screening to a patient who is reluctant to have the diagnostic test. Which level of prevention the diagnostic test reflects? Options are primary, secondary, tertiary, primordial. So the question is a staff nurse is explaining mammography screening to a patient who is reluctant to have the diagnostic test. So the level of prevention, the correct answer is option B. Option B is the correct answer, that is secondary. Next question. The individual's red blood cells contain a number of proteins called options antigen, antibodies, agglutinins, agglutinogens. The individual's red blood cells contain a number of proteins. The correct answer is option A, antigen. Option A is the answer, antigen. So the red blood cells which contain number of proteins, it is known as the antigens. The drugs which help in the expulsion of gas from gastrointestinal tract is called. The drugs which help in the expulsion of gas from the gastrointestinal tract is called. Options carbonatives, cathartics, antiemetics, astringents. Answer is option A, carbonatives. Carbonatives are the drugs that help in expulsion of the gas from gastrointestinal tract. Then the next question. The pressure within the autoclave during sterilization is. Options are 10 pound per inch square, 15 pound per inch square, 25 pound per inch square, 5 pound per inch square. So the question is the pressure within the autoclave during sterilization. The correct answer is 15 lbs per inch square or 15 pound per inch square is the correct answer. Option B is the answer. Then the next question. Methotrexate belongs to the group of. Options are alkylating agents, antipyrimidines, antipurines, antifolates. Correct answer is antifolates. Option D is the answer. Antifolates. Methotrexate drugs belongs to antifolates. Then Aschoff bodies are characteristics of. Options are thyroiditis, rheumatic fever, rheumatoid arthritis, chorea. Aschoff bodies are characteristics of. Correct answer is option B. Rheumatic fever is the answer. So Aschoff bodies are characteristics of rheumatic fever. Next question. Which of the following is a DNA virus? Options hepatitis A virus, hepatitis B virus, hepatitis C virus, hepatitis E virus. Which of the following is a DNA virus? Correct answer is option B, hepatitis B virus. Hepatitis B virus is the correct answer. The DNA virus, hepatitis B virus is a DNA virus. Then the next question. Sodium potassium pump is an example of. Options diffusion, osmosis, active transport, facilitated diffusion. Sodium potassium pump is an example of. Correct answer is option C, active transport. Sodium potassium pump is an example of active transport. Then the next question. The etiology for malignant hyperthermia is. Options drug induced fever, injury to hypothalamus, CNS dopamine receptor blockade, inhaled general anesthetics. The etiology for malignant hyperthermia is. Correct answer is option D, inhaled general anesthetics. Option D is the correct answer. Inhaled general anesthetics is the etiology for malignant hyperthermia. Which of the following is a neurohypophyseal hormone? Which of the following is a neurohypophyseal hormone? Options are antidiuretic hormone or ADH, prolactin hormone, luteinizing hormone, growth hormone. Which of the following is a neurohypophyseal hormone? The hormone produced by the posterior pituitary. The correct answer is option A, that is ADH. Anti-diuretic hormone is the correct answer. ADH is a neurohypophyseal hormone. Then the next question. The early manifestation of hyperkalemia seen in ECG is? Options are widened QS complex, absent P wave, prolonged PR interval, tall peaked T wave. The early manifestation of hyperkalemia seen in ECG is? Correct answer is option D, that is tall peaked T wave. Tall peaked T wave is the correct answer. Option D, it is the early manifestation of hyperkalemia in ECG. The volume of air in the lungs after a maximal inspiration is called? Options: vital capacity, tidal volume, inspiratory capacity, total lung capacity. The volume of air in the lungs after a maximum inspiration. The correct answer is option D, that is total lung capacity. The volume of air in the lungs after a maximum inspiration is known as the total lung capacity. So option D is the answer. Then the next question. Carcinoembryonic antigen is a tumor marker of? Options: colorectal cancers, germ cell tumors, prostate cancer, hepatocellular carcinoma. Carcinoembryonic antigen is a tumor marker of? Correct answer is option A, that is colorectal cancers. Option A is the correct answer, colorectal cancers. So carcinoembryonic antigen CEA is a tumor marker of colorectal cancer. The prominent manifestation of thalamic hemorrhage is? Options are deep coma that develop immediately, pinpoint reactive pupils, contralateral hemisensory defect, occipital headache. The prominent manifestation of thalamic hemorrhage is? Correct answer is option C, contralateral hemisensory defect. Option C is the correct answer, that is contralateral hemisensory defect is the prominent manifestation of thalamic hemorrhage. Next question. Phantom limb pain is a type of? Options are somatic pain, central pain, sympathetically maintained pain, nociceptive pain. Phantom limb pain is an example or it's a type of? Correct answer is option C, sympathetically maintained pain. Option C is the correct answer, sympathetically maintained pain. Next question. Rifaximin is administered for? Options: vasoconstriction of splanchnic arteries, prevention of viral infection, correcting hyponatremia, preventing release of ammonia in the intestine. The correct answer is option D, that is preventing. It is not a relapse, it is release, preventing the release of ammonia. So please note this option is release, preventing release of ammonia in the intestine. So rifaximin is administered for preventing the release of ammonia in the intestine. So correct answer is option D. Rifaximin is administered for preventing release of ammonia in the intestine. Sucralfate acts by? Options: conversion of pepsinogen to pepsin, cytoprotection of the gastric mucosa, improves esophageal and gastric emptying, increasing gastric motility. Sucralfate acts by? Correct answer is option B, that is cytoprotection of the gastric mucosa. Sucralfate act by cytoprotection of the gastric mucosa. Next question. Appearance of U wave in ECG is manifestation of? Options: hyponatremia, hyperkalemia, hypercalcemia, hypokalemia. Appearance of U wave in ECG is a manifestation of? So here the correct answer is option D, that is hypokalemia. Appearance of U wave in ECG is a manifestation of hypokalemia. Next question. Patients with Guillain-Barré syndrome are prone to develop? Options: respiratory acidosis, metabolic alkalosis, respiratory alkalosis and metabolic acidosis. Patients with Guillain-Barré syndrome are prone to develop which problem? So here the correct answer is option A, that is respiratory acidosis. Patients with GB syndrome are prone to develop respiratory acidosis. Thank you for watching this video. Also, please watch the other videos regarding the MSc Nursing Entrance Examination question papers, and these videos will be useful for all competitive nursing examinations. And also don't forget to like and subscribe the channel.